Well, thanks for that, Maureen. Welcome to the studio. Cabinet Secretary now is with us, James Macharia from the Ministry of Health. Maureen said in that story it was a light run. You were there. Was it light?
Well, indeed, we really struggled because the first lady is very, very fit.
Okay, she's been training.
Yes, a challenge.
She's been training.
Yes.
But on a more serious note, over the past 10 years, maternal healthcare, there's been a major issue around, the mortality, deaths of mothers and children. And instead of improvement, actually there's been a decline, which is really shocking. And so let me start there, Bwana CS. What is your ministry doing about this? And how can you partner with efforts like Beyond Zero to transform the situation?
Well, thanks, Jury. I think the first thing to do is to accept that indeed we have a big problem. We had a big problem over the past 5 to 10 years, whereby the statistics are very worrying. For example, 5,000 women, our mothers and sisters, pass on every year. Then we had 100,000 kids passing on every year under 5 years. And then we have 13,000 kids being infected by in HIV or with HIV by their mothers. So those statistics are very worrying. And so what we've done is actually to introduce some interventions. Some of them were immediate, others will be strategic. For example, you recall that within 2 weeks of us coming to government, the president introduced free maternity services. It's costing us 700 million every quarter. Over the next three quarters, it will be about 2.8 billion. And that's a lot of money. Secondly, you recall 10 days ago, we had the president and the cabinet approve a scheme to equip our hospitals to a tune of 34 billion Kenya shillings. Because you can have hospitals, but if they're not equipped, the mothers you go there, they can't deliver in case of emergencies. Thirdly, we had this employment of nurses, which has been ongoing, because almost every facility is actually at a big shortage.
Let's talk about staffing. Let's talk about staffing for a moment. And of course, we've had the problem of strikes. And in fact, if you look at the data, there's clear information that lives have been lost and there's been an impact on mortality rates, especially maternal, when it comes to when strikes take place. Threats, once again, that it could happen. We can't afford another strike. What are we going to do to streamline issues when it comes to healthcare professionals in Kenya?
Yeah. Well, certainly what you have to do is to make sure that we have enough personnel for a start. And for that, we have allocated a budget of 3.7 billion in the 2013-2014 budget, whereby we shall employ about 9,000 nurses. The gap is very wide because as of now, it's about 42,000 in terms of the gap, which has come up as a result of the previous years. If you are to employ enough numbers, we have to reach about 70,000. Currently, about 26,000 only. But those nurses have to be motivated. And that's why we're working very closely with the county governments to make sure that these issues, these teething issues, are dealt with permanently. We get very worried when we hear that people's salaries are being deducted. And personally, we have actually gone out and asked for those pay slips, because that's something we cannot allow. Let's
talk about that issue now. And of course, there's been a push and a pull between the ministry and the county governments as well. But the partnership is a big one. In fact, I think your ministry has said it's probably the one that engages the most with the county governments. But how are you going to work together to ensure that matters like this are dealt with? You ask for the pay slip, what next?
Well, I think initially you have to work through certain structures. For example, there's what we call Intergovernmental Sectoral Forum, which is a formal forum which brings together the county executives for health and the ministry, and I chair that forum. Secondly, we have the other projects which work together. For example, this equipment in hospitals. We had to get the governors, all of them, 47 supporting it. And then we're also working with the county governments to put facilities in our slums. Because if you talk about accessibility of healthcare, you have to go really where it's needed. And that's in the slums, the rural areas. So already we started one scheme. The first is being done in Lugalunga. Governor Evans Kidero did sign that about two weeks ago, because we have to work together with the county governments.
Okay, I'm going to move on from that to to quality of healthcare, and specifically because of HIV, correct me if I'm wrong, HIV/AIDS probably still the biggest problem when it comes to healthcare in the country. But now we're seeing, for instance, an increase in deaths caused by non-communicable diseases. The question is, are we prepared to deal with this? Do we have the equipment? What about the expertise? Can your ministry fund all this? What's the next step in terms of policy?
Yeah, clearly there's been a shift in terms of the trend of diseases. Previously we used to have HIV, malaria and so forth. So a lot of money was put in those areas. But HIV, despite the emotional attachment, that rate has come down. Currently it's about 5.6%, from 13% in 2012, 2002. So it's a big drop. However, at 5.6, we are still among the 5 top countries in Africa with HIV. So that still have to be dealt with. And fortunately, we're working a lot with our partners, the US, PEPFAR, Global Fund, to make sure that we sustain the reduction. However, as you say, we have a new trend now of these non-communicable diseases like cancer, diabetes, hypertension. And it's a big issue because those diseases are very expensive to treat. That's why you find about 7,000 Kenyans travel to places like India, South Africa for treatment. We want them to remain here because emotionally it's very stressful. And what we are doing is to make sure that once we equip the hospitals, we train our people in those specialist areas. For example, oncology, which is cancer. We only got 12 specialist oncologists working in public hospitals. That's incredibly worrying. So what we have to do is work with the international partners to make sure that we have enough personnel to treat our citizens.
Right, and just to end, we nearly won the war against polio. We've seen some people resisting immunization, and therefore polio is still with us. While people may think health issues are medical, there's a lot of social issues that come with the conditions that we suffer. What message would you have for Kenyans on how they can support the ministry and indeed support themselves by what can they do to live healthier lives?
First of all, we have to eliminate polio because currently we are among the only 8 countries in the entire globe with polio. And our polio was imported from neighboring countries. But coming to Kenya, we have to deal with it. It was completely eliminated by 1984. But since then, in 2006, we have had polio cases, in total about 36 so far. And as a result, we have actually brought in some interventions. We've had about 5 campaigns, including one which was completed 2 weeks ago, to immunize every kid under 5 years. Now we are even introducing vaccinations for adults because you saw India did brought some directives to say Kenyans cannot travel to India without vaccination. So we have to sensitize people, surveillance in our borders, especially northeast, eastern borders, Somalia and southern Sudan, to make sure that nobody comes across without being immunized. And we must prevent it, otherwise we shall get the same problem going ahead.
What other support do you need from Kenyans? Literally in 30 seconds. Is family planning a big issue? Is it safe sex? What are the 3 key things you'd say to Kenyans in 30 seconds, literally?
Well, I would say in terms of managing the youth, because the youth vis-a-vis diseases like HIV, there's a lot of peer influence. So we need schools to introduce programs which sensitize people about HIV and pregnancy, other pregnancies, because those are the ones which bring now the issue about maternal health. And also, I would like Kenyans also to live healthy in terms of lifestyles. Cancer never used to be a problem, diabetes as well. So they need to live healthy, they need to exercise, they need to check their diet, and so forth.
Thank you so much for joining us in studio. Please do send your views. Tonight what we're doing on the show is asking for views on healthcare in Kenya, and we will forward all those views to your ministry so you can understand the situation that people are facing in various parts of the country. Thank you so much for joining us in studio. Just a reminder for you that if you want to be part of the Beyond Zero campaign, you certainly can be. Registration is 1,000 shillings, and you can register at various centers, Uchumi, Equity Bank, across the country. If you can't run, register anyway and support the cause. And many of us will be running on March 9th for maternal health care in the country. Share your views with us once again, 22422 on Health in Kenya, and we'll forward them to the ministry.